Toronto General Hospital is under a critical care bed alert and has been for about 2 weeks now, saying its 3 intensive care units are at full capacity, and burnout among healthcare workers is a major part of the issue.
I can tell you that we're hanging on by a thread in many different circumstances.
Toronto General is reporting their cardiovascular, cardiac, and medical surgical ICUs are at capacity or have limited human resources to safely keep all beds in operation. While daily surgery patients are being factored into those capacity limits, right now emergency patients who have a stroke or suffer head trauma, for example, will be sent to other locations.
I think one of the number one reasons for that is understaffing, long-term neglect of this sector, and our governments need to step up to take action immediately to protect our healthcare system.
Did this happen before? Did we see hospitals at their ICU capacities? Did we see ERs shutting down temporarily?
Every once in a while, a hospital will used to hit a sort of a freak incident.
Diane Martin with the Registered Practical Nurses Association of Ontario says critical care alerts used to happen from time to time, and then during the height of the pandemic they were common, with patients either being triaged or sent to other locations. And she warns this will be the norm if we don't get a handle on the nursing shortage.
If we don't start to solve the problem yesterday, patients who are critically ill, we're going to lose some people.
According to the Ford government, over 10,000 staff have recently been added to the healthcare system. But a new workforce survey by the Ontario Medical Association found the vacancy rate for nurses is now in the double digits, more than 12% for registered nurses and over 10% for RPNs. The overall vacancy rate right now is almost 9%, and that's a jump of about 5% since 2019. And a new study by WeRPN finds this could be the tip of the iceberg, with almost half of its nurses on the brink of calling it quits. The survey also found 7 in 10 say they are unable to provide adequate patient care due to a lack of available time and resources.
Are these patients being told that the careful monitoring that's done by nurses is actually at a much, much lower level than it was pre-crisis? And what is the impact on the outcomes for those patients because of that?
Now, typically a critical care bed alert would be in place for 2 to 3 days, but the one here at Toronto General was issued back on July 22nd, and I'm told that it will remain in place until they're confident that they have sufficiently staffed ICU beds for both medical and surgical patients.